I had been really thinking about it. My practice the year I bought that literally grossed $70,000. I had just started had opened my holistic practice. It was very small. It was very beginning. And so that was a really big, when I was sitting looking at, okay, what's the cost of this laser? I really think it's amazing. How can I incorporate it into my practice? How can I make it profitable and pay for itself? You know, when your practice is that small, you just have to make bigger considerations when you're making a purchase that's, you know, what, a sixth of your entire gross revenue. And the precipice that to make that happen was that my daughter fell off her horse and broke her leg. And so we medevaced up to Shands and we had an interlocking nail done. And while I was sitting outside of the surgery suite waiting for her to come in is when I called my rep and said, okay, here's my credit card number. Make sure that thing's on my door when I get home. I'm going to use it for my daughter and then I'll blend it into my practice. So there, I already had the strong belief that it was incredibly helpful. That was mistake, you know, good, bad, or otherwise, that was what really pushed me over the edge to purchase it, was really for personal use, because as Malia will get into, it is of course used in the human world long before we got the ability to it, which is so common in our veterinary field. You know, the human modalities get lots of things well before we do. So after I bought that, over the next decade or so, I really expanded my use of it. I expanded the ways I used it, how frequently I used it, what my staff knew about it. And so it really just expanded. Over that next decade, I bought 4 more. So I had a total of 5. The PL 5000 is the older version, but again, exact same philosophy. And by about 2019, I was seeing so many cases that I just couldn't properly care for them with the laser therapy. They would hugely benefit from laser therapy, but for various reasons, they just couldn't get into my clinic, whether it was be that I've got clients that come from hours away, whether it be that I had a whole breeding facility of mastiffs and several of them had blown both cruciates at the same time. And so to get a 160-pound dog in a car, drive it to my clinic, get it out, bring it in for a laser, I really looked at, I think the dog was creating more injury to get to my facility than I could facilitate in recovery. And my horse stable that I work at, that I integrate the holistic things in, there were just so many places. I can't get back to the stable every day if I'm needing to do a half a dozen lasers a week for some kind of acute injury. So there were just those circumstances that I just really saw the ability to expand the quality of care for my patients with having it. And so in 2020, I bit the bullet and I bought 3 more units. And immediately I had already started renting the ones that I was using. So that was an issue because I would not have enough to work in my practice. There are days that I'm doing 15 to 18 laser treatments a day in my practice. So, you know, that ended up being a problem because there's only so many hours in the day. And so I usually had 2 technicians in different rooms doing different treatments, which is why I needed multiple. And so that first year, now I bought this in October, my first year of rental. I remember I'd started renting the ones I had for a few months before. I got about $8,500 that first 4 to 6 months that I rented. And then just the rental part has built up to about 15,000 last year. So in 2 years, it's doubled. And that is not the only component of it. My in-house lasering has also continued to grow. So it hasn't become a situation of I traded one off for the other, that now I'm not doing as many. My in-house laser therapy has continued to grow and my rental laser has. And it's really brought a lot into my practice. The scenario that I bring to is that $30,000, that's about annually what I do for in laser, what I did in 2022. That's about 5% of my gross revenue, which in a bigger practice that again is doing that surgery or doing those dentals or doing all of those type of things, so much more opportunity to just bring that into the fold as the day in, day out treatment that is recommended that can provide such benefits. So again, I'm definitely a little fish in a big pond as far as the potential that the income could be in a full facility. So that's just something to keep in mind. Now, you know, in general, why would we want to rent out a laser to begin with? It's an expensive piece of equipment. We're taking a risk sending it home to the client. Are they going to use it right? All of these things. Number one, with the Erchonia lasers, they are a class 2. They are completely safe to send home. Heck, I've got a dozen clients, good, bad, or otherwise, that have purchased their own. And so that is one thing that is different from our class 4 lasers. Is with our class 4 lasers, ourselves and our technicians all need to be certified, obviously, because there's injurious risks to it. And so that, we don't have the ability to send those home. And the Erchonia layers has really left that. But again, as was seen in my practice, it really increases the quality of care of my patients, because those big dogs with the cruciate injuries, those horses that had injuries that I'm dealing with at the stable, those were just clients that I could not get frequency enough in the laser treatment to get as much benefit as I felt I could have. Of course, we're always wanting to expand our practice. So that's, a no-brainer as far as that. We're always wanting to grow our practice and figure out how we can serve our clients better, increase our revenue, and increase our specialty. The decreasing staffing needs is simply the circumstance of not trying to decrease the number of people that are working for us, but the fact that I don't have to have a staff member stand there and do that laser. I now put it in the case, send it home with the client, and the clients are the ones still being my staff member. So, that kind of helped me grow without having to grow my staffing. We're all struggling with staffing issues right now. And really incorporating pain management. I have seen pain management just come alive in the last decade or so. 20 years ago, we didn't send our spays and neuters home with pain meds and all of this stuff. Our orthopedics we did, but not that. And now we are really recognizing not only the pet's comfort and needs for that, but also just the emotional bonding that owner has for your dog just had a major abdominal surgery, or your cat or your horse. And we need to get adequate pain management to help them heal better, to not have them suffer, to make them recover quicker, all of that stuff. And so, incorporating this low-level laser can just be an incredible new way to really holistically introduce pain management into our surgeries and injuries. Our pancreatitis is everything that has a pain component to it. The clients are more engaged in their pets' recoveries when they're getting these more frequent treatments, whether they're doing it at their home or in the office. They're just more engaged. They're looking at things every day because we've geared them towards, here's what we're looking for. And it is a specialty that will draw client referrals. I have 1 to 2 a week of people that call me up simply because they have heard that the type of laser that we have, we're the only one in our community that has these Erchonia lasers that can be rented and taken home to enhance the sheer number of lasers therapies that the client can get into the pet. And so we've actually started getting an outside referral system going just to come in and get our lasers and our rental lasers. So, that in itself can expand just what we're doing with our practice. And then, of course, when that client comes into our practice, we tell them about all the other wonderful things and why we're the best of the best. And so we can gain client bases as well.